Good morning or good afternoon, depending on where you're at. This is Benga Adeeko. I am CEO of NewGait, and I've got two of our clinicians on this web call. We've got Cathy Ruprecht, who is our pain specialist, and then we also have Kim Spranger, who is the originator of the NewGait, really. So we're going to be interviewing Cathy, talking all about chronic pain and how the NewGait has helped. Cathy, can you give us a little introduction on yourself?
I'm a therapist from Michigan. I've been practicing now for 21 years, and over the years I've fallen into a real passion for working with folks with chronic and persistent pain, and that's my specialty. My client population has some sort of long-term pain diagnosis when they come to see me, and so I get to work some magic with them and I get invited into their lives, for which I am very thankful and honored to be a part of.
And how long have you been practicing?
21 years.
How did you get introduced to the NewGait?
Well, my colleague at the time, Kim Spranger, had just come across the product, was using it with a client. One day brought it out, dumped it onto the mat table and said, "Look at this neat thing that I have here. Let's try it and see what we can do with this, because I think this has great potential to help people." So I looked at it and I said, "Okay, I'm game." And so we started to use it with clients in the clinic, and 4 years later now, it's been quite an evolution and revolution in our practices, and that's been quite an honor to be part of that journey.
And what is chronic pain, and how is it caused?
Well, chronic pain is how we classify pain that's long-term and persistent. Usually when someone has an accident or an injury or surgery, there's some sort of a tissue damage. It's usually repaired within about 3 months. Most people heal right up and go on about their business, and they don't have much pain remaining at all afterwards for any length of time. But in some individuals, pain is persistent and can linger for years after someone's had an accident or an injury. Or we've also learned that pain can come on without an accident or an injury of some significant level of tissue damage. And so these individuals find this pain to be life-changing, life-altering, very disturbing for them. And so my job is to try to teach them about pain and get them moving again. And that's been the journey that I take them on. Typically over the years, we have now in recent times begun to look at pain a bit differently. We always equated tissue damage with pain. But we've now learned that some individuals have no tissue damage and significant levels of pain. Some people have significant tissue damage and no pain. And so pain is very complex, and we now define it, instead of a biomechanical model, we now look at it as a biopsychosocial model, where there are many aspects of our emotion and our memory and our brain thought processes that contribute to someone's pain experience.
I'd just like to add to that, Cathy's journey with chronic pain has been very interesting. In the 1990s, we were both asked in different sorts of ways to get involved with developing chronic pain program for our region. Cathy took it to a totally different level. And actually in the last couple of years, she has developed a long-term philosophy on how to treat chronic pain that all of us have now adopted and are using in our clinics. I can think of a patient this fall who, when we were using Cathy's strategies with a patient, she came back and she said, "This has changed my life. I want you to know how much you've changed my life by the way that you've approached my pain." So I want to give a whole lot of credibility to what Cathy's saying, and she has changed the way we are treating chronic pain across the Upper Peninsula of Michigan.
Thank you for saying that.
Very well said. Cathy, how exactly does someone get diagnosed with chronic pain?
Many individuals have been to multiple doctors over time and have had multiple procedures done for which their pain seems to be unrelenting and ongoing. And at that point, sometimes the physicians will say, "Well, this looks like a chronic condition for you, or a chronic pain. We don't see anything that's life-threatening. We don't see anything that needs surgery or operations. You're medically stable. So at this point, we're going to diagnose you with having chronic or persistent pain, and perhaps a different approach for therapy may be helpful for you," and that's oftentimes how people find their way to me.
And what is the standard treatment of care for folks with chronic pain?
What I practice is pain is not just a tissue damage issue. So people they come in with their whole body, they bring their minds, they bring their thoughts, they bring their ideals, they bring their beliefs, they bring this history of their pain. And so with the practice that I use, it's a biopsychosocial model of pain. So we look at pain on multiple levels as far as what's your stress levels like? Are you getting good sleep? What other aspects of your health might be contributing to your long-term pain? And how might we utilize those aspects to help you change and regain control of your pain? So oftentimes I'm not there to try to change pain. I will explain that I don't have the magic exercise. I don't have the magic power in my hands to take your pain away right now. But what we're going to recognize and build on is that you're medically stable and that what you have, you can do things with. And over the course of time, as you increase your activities and as you start to lose some of the focus on the pain, you'll find that it does become less intense and less frequent and less debilitating as we move forward in this different way to look at pain. And so I spend a lot of time working with people in their body awareness. Many people, when they have chronic and persistent pain, they really don't have a great mind-body connection. They're not very aware of where they are in space. They really view sometimes their own body as the enemy. They don't want to think about it. All it is a source of pain. And so I try to reconnect them to their whole self. And that's the fun of what I get to do. So we work on all sorts of aspects of use of mirrors for looking to see where we are in space, focusing on movement patterns that are comfortable, body parts that don't hurt. And so I have a whole toolbox of things that we go through and teach. But we also really try to work on understanding lifestyle's contribution to pain, anxiety's contribution to pain, fear and worry and anxiety's contributions to pain. And so we want to try to break this cycle of how someone might be living by giving them something new and different to do that then will allow them to move forward with less frequent, less intense pain.
That's really interesting. How does what you do compare to what the average physical therapist do for someone who comes in with chronic pain?
You know, each therapist develops their own beliefs and their own toolbox in working with folks with chronic and persistent pain. So say, for instance, someone comes to me with back pain. Typically, a therapist might do some manual therapy on them, massage, electrical stim, those kinds of common treatment tools that therapists use, certain exercises to build the core and build core strength and that kind of thing. But my philosophy is I spend a lot of time on education, on really understanding the nervous systems, how they function to keep us safe, and then how that nervous system can be manipulated through some new tools like your breathing can change the way your body is perceiving itself and to create changes within our nervous system's connections to the brain. And so what I do is a lot of education, a lot of mindfulness, a lot of breathing, and again, body awareness. And so we try to build different tools into a box that a patient might not have seen before. Because many times when people come to me, they'll say, well, I've been to therapy before, and been there, done that. What are you going to do that's different? So in order to really do something different, I have to have something different. And so that's one of the tools that I use is the NewGait, because that also is something new and different in helping people with chronic and persistent pain.
Cathy, how does the NewGait help with chronic pain? Or how do you think it's helping?
I wish I knew exactly. If anybody wants to do some research, call me. But I have some ideas and some theories on it in taking what I know and combining it with what I see. And so there are a couple of things that I really have some strong opinion and belief about. There's a woman named Amy Cuddy. She's a PhD, and if you're not familiar with her, she's written a book called Presence, and she has a fabulous TED Talk on YouTube about posture. And in her TED Talk, she talks about our bodies and our minds, and she says that our bodies change our minds change our bodies, and our minds change our behaviors, and our behaviors can change our outcomes. And to me, that's a really very powerful statement. And in that, when we walk, walking is a really important component for treatment of chronic pain. When we walk and when we do cardiovascular exercise, it changes our blood flow, it changes all sorts of physiological responses within us, and for many people with chronic and persistent pain, it can really help to decrease their level of their pain. And so when you have people with chronic persistent pain, the last thing they typically want to do is go for a walk. And so the NewGait allows me to make some changes in how they walk. It allows me to change their postures. And so by changing our postures, Amy Cuddy, again, relating back to her, has done a lot of research to show that when we change our posture into more powerful, upright, balanced alignment, we really are changing our body's physiology. We're decreasing cortisols and stress levels. There's a powerfulness that almost feels like it exudes from you when you change your postural alignment and positioning. And the NewGait, by putting it on, it gives my own self, plus what I hear from my clients, it gives us a sense of grounding, if you will, or a sense of scapular depression is what I often feel. And I feel myself draw taller. And when I do that, and from what Amy has stated in her research, we are making a change in our physiology. And anytime we can decrease stress and cortisol levels, we're also then able to change the nervous system to a more relaxed, comfortable positioning. And so therefore then many clients report that they feel less pain. And that had been a really interesting and rather unexpected benefit of the NewGait's use with clients and patients is when they literally turned to me and said, I walk now and I don't have any pain. And that was really not something I had anticipated or expected. But I'll tell you, when I heard it the first 2 or 3 times from patients, I said, wow, there must be something going on here. And so that's when I really started to embrace the NewGait as a device to help change people's movement patterns. Many people, when they come in with persistent and chronic pain, they have a really distinct posture. They are very withdrawn, pulled in, pulled down. And so if you change physiologically by straightening and being taller and standing and occupying more space, then that's a huge benefit again in pain management. Plus, when I put people into the NewGait, I also believe there are some other factors happening. I've recently read a book called Explain Pain by Laura Mermosley and David Butler. And they have some ideas for which I grasped a hold of when I had read through that also then relate to the NewGait for me. A couple of things that they had said was, you know, your body, your sensory system, your nervous system is reporting constantly to your brain different things. It senses temperature, it senses mechanical pressures and stimulations, and it senses chemistry within you. So certainly when we're in a state of stress, then we're going to have more bombardment of those stress hormones, and that can again elevate someone's pain. So when we're able to change physiologically their posture, that to me is soothing for the nervous system. The other thing about the NewGait is it creates a joint congruence. And once again, relating back to Explain Pain, when we have joint congruence and there's an approximation increase at the joint, specifically I feel it through the scapula and at the hip joint, at the greater trochanteric joint, when I experience that sense, my body feels more calm from that congruence. And also, when we're in a stress state, we also tend to operate with our bigger extrinsic musculature because we're in a heightened state of arousal, ready for flight or fight. But when we're able to become more relaxed and more confident within our body, the smaller intrinsic muscles like your multifidi and your postural control muscles and your ability to breathe deeper with your diaphragm is also changed, and the body finds that calming as well. So there's definitely, from the NewGait, a sense of deep pressure hug. You feel it around your thighs and calves, from the limb strap, from the shoulder harness, from the waist strap. That's changing sensory input to the brain. And that then is what I believe is giving people a sense of decreased pain as they move through space. What's been interesting is also how people move with chronic pain, their gait pattern. You see a real lateral side-to-side gait pattern. Their movements are slow and guarded. They're usually dragging along some sort of a limb. So oftentimes I see people who have had knee pain, hip pain, back pain. They might have piriformis syndrome, where they've got a lot of gluteus maximus pain in that region. They also might have some sort of sensory impairments, like they've lost dorsiflexion, or they've lost their ability to push off, toe off, and they've got no power in those gastrocs to push off. Well, every time you bring your leg forward into swing phase, that creates this lurching motion. But with the NewGait, I can change that. I can change their step width to make them more balanced. I can change the ease with which they get hip flexion. I can give them a quicker break over at the ankle for a faster push off at that toe off moment to start the swing phase. And so it's been really interesting to see the changes in gait. Again, with an improved posture, I can initiate trunk rotation and arm swing. And so the results of use of the NewGait with my chronic pain patients has been really quite remarkable, not only for me and for them.
Wow, very well said. How many patients have you seen with the NewGait?
I pretty much have it on everyone. At least when people come to me, I really want to see how they move. I want to increase their walking confidence. I want to increase their walking speed. We know now that walking speed is indicative of someone's longevity. And so I want to make changes in how they move, because that is so essential to life. Walking and walking briskly to cover ground allows us to take our minds out to explore, and it allows us to do the things we no longer have been doing because of our pain. And so I really focus a lot on gait and movement and walking as a treatment strategy. And so I videotape everyone. I get a walking test on them to see how fast they're moving. I analyze that video. I look at their movement patterns. And then we look at it together, and they can see how they can move differently. And the cool thing is, sometimes when we get the bands just right, and I don't know where exactly that's going to be, there's different configurations of the NewGait that I will apply. And what I'm looking for is that individual's nervous system to tell us when we hit that eureka moment, when they suddenly say to me, wow, I'm walking without pain, or wow, my pain is down significantly from when I came in here. And for some people, there's carryover. They have less pain. It might be for an hour after they see me. Sometimes it's up to 3 or 4 days after they see me. So there is a huge neurological change happening within them when they use this device. And so I don't know exactly who that person's going to be, for whom they break into tears and say, oh my gosh, I haven't walked like this in years. But if I don't put it on someone, I won't know who that person's going to be, and I may have missed an opportunity to really change their life and change their gait with this really unique tool that gives them a different feedback to give them a different output of their pain than they'd experienced ever before.
How long and how often will a patient need to use the NewGait during a particular treatment plan?
I let the clients guide me. They'll come back and I'll say, how did you feel after you were here? What was your experience? And many times they'll say, I went to the grocery store and I walked, or my family noticed I was walking differently, or my father said, oh my gosh, look at my posture. Look how straight and tall you're standing. Look at how much faster you're walking. And so I get their feedback. And if they feel like they are now doing better, they may not need it again. They have that change of perception in self that we were looking for. Boom, we're good to go. But sometimes they'll say, I want to try that again. I can't wait to get back in that, because I felt so different, so much more powerful, so much more confident, like I could walk like I used to. That's what they're looking for with me. So each person has their own response to it, and I let them guide me.
Can I ask a little more of a question about that?
Yep.
So let's say they come into therapy and you put it on the first time and they really liked it. Then when you put it on them a second time, what exactly are you going to do with it while they have it on?
Well, what we work on then is body awareness. So we'll go to the mirror and we'll work on posture. We'll work on balance in single limb stance. We'll work on, well, where are my shoulders? Where is my levelness in my waist? How am I aligning myself? And so we'll look at all of these different changes that we're trying to establish as they're standing and trying to recreate a new sense of self. I'll have them climb stairs. I'll have them do step-ups. Where is your weight? Using your gluteus to give yourself a lift. Think of the weight through the heel. It's a lot of, where are you in space? And so we work on proprioception again, both with the mirror, sometimes without the mirror. We'll work with sport cord. I'll have them do some upper body work with resistance bands while they're stabilizing the posture, while they're stabilizing the lower portion of their body, while they're wearing the NewGait. Sometimes we'll go out for a walk in the parking lot, or depending on the weather, we might go over some hill and dale, up and down some different levels of terrain. So we're using it in the clinic to walk, we're using it in the clinic to stand and reshape where we feel our body. And again, it's that mind-body connection, I think, that really helps people have a new perception of how they move, that they can move differently, and by moving differently, they sometimes feel a whole lot better.
And what is the reaction of your patients when you first proposed to use this thing, the NewGait?
So remember, many times people have been to therapy elsewhere, and so in order to try to provide something different, I will say, hey, and then I have this special suit that we can try. And many people find it very helpful for teaching you about where you are in space, and some people really love this to walk in, and you might too find that it's helpful for getting you to move like you used to move more comfortably and more confidently. And so they're so wonderful. They're so wonderful to give it a try. And I tell them too, if you don't want to, or if this isn't comfortable, you just have to tell me, and we will be done. But let's see how it feels, because your body's going to give us a response. Just like it's responding to the fact that it's unhappy about something by giving you this perception of pain, right? When we get it different, suddenly your body goes, hey, I've been waiting for a long time for you to change up the way you've been walking. Now I don't have to report about that pain anymore. And so we play with we're really just manipulating the nervous system maybe. And that's what we do. We think of it as fun and it's playful, and I try to make it entertaining, and so they're pretty game to give it a go. And the best ones are the ones that give you that skeptical eye, that they're quite sure that you are just nuts and this isn't going to make a change. But they're the ones that are the most rewarding, of course, because they're the ones that go, wow, I didn't expect that. So that's really, it's a joyful day for me to go to work. It's a joyful experience to get this on people and to do the magic that I get to do with them and share what I am so passionate about, and to have them respond to it so positively.
Talk a little bit about how your outlook on work and your profession has changed now that not only do you have this tool to use, but also you're a part of this team.
It's been a very joyful experience, one of the most rewarding of my life, especially at this point in my career. So to be able to go to work and to bring to someone a sense of hope that their life can be different, and so that's a pretty joyful experience right there. And we've now taken the NewGait to some clinics and shared it with other therapists while they have their own clientele there. And to see the response from their own patients, to have a clinic of several therapists, tearful and joyful, literally patients walk and blossom before your eyes. It's almost for me a euphoric high. I mean, I just can't tell you how cool it is to be able to use something like this in a clinical setting and to have such a dramatic result in such a short amount of time. That's just been a game changer for me. It's like putting on an erector set on someone and just manipulating a band here or trying a band there, or working as a team with the other therapists and the patient's input to just get the right combination to have that person move with ease and confidence. And it's just been the most joyful thing.
Kim or Cathy, do you have anything else to say or anything else to ask?
I love how adaptable this is and how quick I can manipulate and change it That is the absolute appeal of it to us clinicians, is that you can be inspired, and in a moment's notice, you can react to your inspiration and change their world.
The results are instantaneous. I mean, you put it on and they walk 3 steps away from you and you can see the result of it. You don't have to let them walk for 5 minutes or 3 days. You know instantly whether that band is right where you want it or not. And if not, you just change it up and put it somewhere else and go with another option for the use of the device. But for again, from a therapist perspective, from trying to really change walking, what tools have we had in the past? We've had ACE wraps and we've had some TheraBand. But this, when you put this on as a therapist and you feel what this can do, you will be amazed, blown away, because then you're going to know exactly like what patients, oh, I should have used this, I should call up so-and-so, have them come back, I got this new tool, I bet I could manipulate that part of their gait pattern. It is just really fun. And sometimes therapists are a little intimidated by it, of course, because you want to do the right thing. But you know, when sometimes we're very analytical about it, like, well, I don't know what muscle's not working, I need to put this right in the right places. You know, sometimes I think I know what this person's going to need. And I put it on and they go, nah, it's not working for me. So then I'll go, well, okay, let's try this here, let's try this there. And all of a sudden, boom, you get it. And so it is so easy to use. You can put the bands in any combinations, and your client is going to give you immediate feedback back on whether that was the way to go or not. And they too will offer suggestions like, well, what if we put a band? Well, let's try it. And then boom, off they go, and they're happy as a clam. So it has been, again, a really cool manipulative tool in the clinic that we've tried to use before. And there is research out there, even though this is a relatively new product, and boy, there's a lot more research I'd love to do, and it's my partners too. But there is research to support the use of TheraBand in a gait-assisted pattern, and this is, again, TheraBand type elastic band manipulation of movement. And so there's also different suits that have been designed over the years, as we recently came across, that also have support to show that this type of an idea is beneficial. And this, again, this product is just so easy to use, so affordable, really, for clients to purchase for home if they need one for long term. And the other thing about chronic pain is people often say, well, but it's chronic pain. You know, it's not a neurological condition. It's not an orthopedic condition. Well, yeah, it is. My people often have orthopedic conditions. They've had knee replacements. They still have pain. They've had all sorts of surgeries on all sorts of body parts, fused ankles. They have had stroke. They've had failed back surgery. They've had MS. They've had all sorts of chronic and persistent pain from a multitude of neurological and orthopedic, and sometimes the both. And this device has been able to help any and all of them. And so that's what's so cool about it.